Hey everyone, and welcome from Valleywise Health and the Valleywise Health Foundation. We really appreciate all of you tuning in for a little moment to hear about some of what we're up to.
So let me go ahead and introduce. We have two wonderful people with us today. Dr. Anthony Dunnigan, he's the VP and Chief Medical Information Officer for Valleywise Health. He's Assistant Professor of Internal Medicine at Creighton University, Assistant Professor of Biomedical Informatics at the University of Arizona College of Medicine in Phoenix, and he's Adjunct Faculty Member, College of Health Solutions at ASU. So he has all the schools covered. He attained his medical degree from the Uniformed Services University of the Health Services in Bethesda, Maryland, and was a proud public health servant officer for 17 years. He has a master's in biomedical informatics from Oregon Health and Science University and is double boarded in clinical informatics and internal medicine. Prior to coming to Valleywise, he served in leadership roles at both the Veterans Health Administration and the Phoenix Indian Medical Center. So now let me tell you a little bit about Cassandra Altamirano. She's a physician assistant certified by the National Commission on Certification of Physician Assistants. She graduated from the Northern Physician Assistant Program, and she now teaches students in that program. Cassandra is bilingual, and she cares for the residents of South Central Phoenix, the community in which she lives. She practices family medicine and sees patients ages 3 and up. She provides care in the clinic and through video visits, and she's an avid user of technology. So we're very happy to have both of your time today. Thank you.
Thank you.
Yeah, thank you both for being here. Dr. Dunnigan, there's so much going on in the world right now, and especially with COVID, and I imagine it being hard for some to think about any silver linings, but some of what you all have done in telehealth seems to be one. And I thought maybe you could just tell us a little bit. We've heard you say in 4 days, we stood up a telehealth program that we had been working on for 4 years. How does that happen?
Yeah, I mean, this truly has been a silver lining in a way. We've been working on telehealth for a long time. And I think many of us felt like telehealth was going to be sort of a very formal, complicated thing that involved interfacing and a bunch of other complicated technology that we'd have to drop into places and train and learn. And it turned out, by sheer necessity, literally practically overnight, we explored ways to very intuitively deliver a voice and audio interactive experience with patients to them in their homes. We quickly settled on a technology, and we made it very lightweight, very intuitive. Essentially, if you know how to use a web browser and the camera on your phone, you were up and running on this thing. So I think it was a matter of keeping it very simple, and folks like Cassandra on the provider side who just embraced it and helped spread it. And literally within a week, we had the bulk of our system on a footprint of this technology, and it just took off from there. So I think at no other time, certainly in my career, have all these forces combined to allow us to do that so quickly.
It's absolutely incredible. And maybe just touch for a moment on some of the numbers, just to, you told some of our board members here a week ago, just the sheer volume of some of those. Do you mind just touching on that a bit?
Yeah, I think we're 12 weeks in now, so we're upwards of around 40,000 virtual visits, which is just astounding. Somewhere between 40 to 50% of our care is now virtual.
Wow.
And I tell you, if you'd have told me that 3 months ago, I wouldn't have believed it. Our collections were around 20 million, approaching that. So, the rules right now are very favorable. We're able to replace in-person visits and essentially get that same reimbursement. We know the rules will change as we go ahead. But numbers-wise, it's just been incredible.
It is incredible.
So Cassandra, let me jump in. He just talked about, adopting it so quickly. As a provider, tell us about how you got ready, how you got comfortable with it.
So, I mean, there's, the saying is kind of try it before you buy it. So, Valleywise, we decided to kind of go with this platform and see how it worked before we decided to kind of like, definitely, dive all in and, use it. We wanted something that was obviously secure for patients and providers and privacy. And we wanted ease of use. So, I jumped on the platform, like first day, got the tip sheet and the email. I said, okay, let's do this. Tried it myself. Asked my parents to sign in as my patients, asked other colleagues, played around with it, walked them through it as if I was the provider in the situation and they were the real patient, explaining how to sign in and all of that, step by step. And then, we just started to use it in the clinic. Anyone who was kind of willing to try it on the patient side, we went full at it. Had to buy a brand new phone. I had a 5C, and so I had to upgrade my phone in the middle of a pandemic without an Apple store, so that was fun. So we kind of just had to up the tech and see how it went, and it kind of just, it hit off. It was great.
I tell so many that you all are the most resilient group I've ever met, and I think we can, just that spirit of let's do this, especially with that little swagger, says that. Dr. Dunnigan, what do you think the providers are thinking as far as once the pandemic is over? How do you see this going into the future?
Yeah, we're all looking at our crystal ball. So we know the rules will change. Right now we have a video platform. We can also conduct visits over the telephone. My guess would be the telephone piece probably goes away for doing full visits. So we're really embracing the video chat platform, which makes Cassandra's work even more important. The providers absolutely love it. We've done some surveys of both providers and patients. And we actually asked them, once this is all over, would you keep using this? And it was a resounding yes. So
that's amazing.
It's a highly satisfactory experience for both parties. And I think, groups like Medicare and Medicaid, they know that. And I think we'll see something coming out soon where this will have some element of this, ideally forever.
And tell me a little bit, a lot of our donors and especially our board members that are really educated in the healthcare landscape here in the Valley, oftentimes want to talk to us or learn more about our education platforms. So what are we doing with residents, nurses, allied health, all those things? And are there ways that you've been integrating this into the residency programs already? Or tell me a little bit about how that might go into the future even.
Yeah, absolutely. We're now on a version of our video platform where you can have multiple people in on a visit, and that's been amazing. So we can bring interpreters in. There's a key role for learners, both residents and medical students. We're getting this week, in fact, our new interns are on campus and getting orientated. They start next week. So a lot of these folks have seen virtual care and telehealth in their medical school programs. So it's not completely new to them, which is great. So we can learn from them to an extent as they're learning from us. And then we're learning how to bring other members of the care teams, whether it's a nurse or a medical assistant or even a pharmacist, in on these virtual visits. Sometimes we can do that with multiple people at once. Sometimes you can sort of pass the visit around in a way that's very workflow friendly. So that's absolutely part of our tactical exploration right now, is that whole care team, bringing them in.
That's awesome. And I think, that leads right into the next question. I think, we've heard some whispers about, maybe the insurance companies not wanting this to go forward. And I'd love to hear a little bit about just your thoughts on that. It seems kind of crazy to me within just the scope of how much technology has been able to help so many industries scale. And then just our love of tech. I mean, just look at things like the Tesla and that kind of thing, and how people are enjoying, just kind of different levels of lifestyle. So just tell me a little bit about those ideas and what you're thinking from the the provider standpoint?
Yeah, the business model of healthcare has been changing for years. So we've been slowly moving out of what we call fee for volume, right? So it's many people as you can bring in the door. You're going to be able to provide that amount of care and get reimbursement for it.
Okay.
What we've been moving to for years is what we call fee for service, which is based on quality. So it may not depend how many times I physically see you or talk to you, but if we have a care team engaging you and helping you achieve better control of your diabetes, your high blood pressure, and then we have the results of that, which is the common goal between us and the payers. It's a matter of finding the right agreements to leverage that and make it a value-added financially proposition for everybody. So, I think it's just a matter of how quickly the virtual piece has evolved and pairing it to that value-based care proposition. The virtual care where we've gotten things to today, it's a complete game changer for that, changing that model. I know some of the insurance companies are very forward thinking. We've been working with folks that have integrated social care. There's housing components to what some of these folks are doing. There's now going to be a virtual care piece. So, I suspect everybody will get there. We obviously have a very strong lobby to continue to provide this service to our patients. They love it. We love it. It's efficient. It makes sense. It may just be a matter of time.
Seems to me too that in my past, I had some times where I had to have 2 or 3 jobs just to make things work and pay rent and that kind of thing. And if you had access to me a little more easily, I would imagine that your outcomes would be a lot better than me not making the time for whatever reason to get down to see the doc. I mean, because when it comes down to it, I'm going to choose work every time. Like I've got to pay my bills, and I've had those times, personally in my life, and I would think that it just makes sense that your lives would be more efficient and effective and productive with me in those cases, if you had this tool to be able to touch base with me.
Nate, that's a really important part of what we're trying to do. And any of us that have had a virtual visit, we can attest to the healthcare system can be difficult to navigate, even for us, let alone folks that aren't, savvy navigators of a complex outpatient hospital system. So lowering the bar to be able to get a one-on-one encounter with a provider has been huge.
Yeah.
So that, you're absolutely right. Folks have jobs, they have families, they have kids, they have parents, they've got things going on. So we make it very easy now for them to connect with a provider. It's basically we're going to do this at 2:30, we'll ping you, hop on, and you're off and running. That's been a real game changer.
You told me also that it's been able to work well where, say, some meeting cancels, you can send them the note and see if they can jump on early, and then you fill time slots more effectively as well.
There's 2 huge pieces to this incredible efficiency we're seeing, and that's a very important one. Yeah, we can time shift this. So, if my 1 o'clock suddenly can't come in and I'm scheduled to have a video chat with you at 2, I can reach out and go, hey, if you're ready, let's do this now. Let's get you going. And so by and large part, we're doing that. The other thing is our no-show rates for virtual care are incredibly low. I mean, low single digits. So this is business we can all rely on. We can plan for it. And that just makes, not only does that make the day, more robust, it makes it more efficient too.
Yeah, there's a lot of payroll labor stuff there that I would imagine would be very beneficial to the system as a whole, if you don't have gaps all of a sudden. One last note, I just thought you mentioned parents. My dad was an old school construction guy. He had broke his back when he was really young and spent almost 2 years in the hospital. So trying to get him to go to literally friends found him outside, pacing outside the hospital when my daughter was born. That's how hard it was for him to go back in a hospital. And I would imagine this would also help someone like him. That just, you talk about barriers and boundaries and making it easier for people. I would have to guess that's also happening for you.
Absolutely. Cassandra's been one of our pioneers working with our elderly population. Sometimes it's just a matter of finding a family member that can help with technology. You know,
Yeah.
it's also a fascinating glimpse into people's homes, and people are so much more comfortable in their homes. So the history you get and the stories you get are in some cases richer. Yeah, so that comfort and just, you know, like I said, lowering the bar, that, you know, we're really, it's so early. We're just seeing glimpses into how powerful this is going to be.
It's amazing.
So let's go back to Cassandra and tell us a little bit about the patient experience. We heard the survey was so positive with the providers, but then also some of your, you know, firsthand experiences with the patients. I was telling Nate yesterday, my parents did their first telehealth visit about a month ago. It ended up being a telephone visit because they had a little trouble with video, but they're in their 80s. And so I think that the provider was so compassionate with them, not frustrated, compassionate. And I think that's what got them through. So tell us about your experiences.
So we did a patient survey as well. We surveyed over like 420 patients or so, and this was early on in obviously our turnover to telehealth. And we asked them about their experience, like the quality of the care, the ease, you know, the instructions they received, the treatment plan, all of that, how long the appointment length was. And honestly, like, you know, over 95% of these individuals said they were, you know, satisfied or overwhelmingly satisfied in these categories. And you would be surprised, the age groups that we surveyed, and Dr. Dunnigan can speak to this. What age group do you think would have, you know, had the highest number of responses? Any guesses?
Younger?
So our highest response, about 35% of, you know, of the group, was 51 to 64-year-olds. And so, and in my experience, actually, I would say it's probably pretty consistent, you know. So, you know, you really have to kind of step back and think, you know, again, it's the ease of this, you know. I've done you know, these video visits with patients over lunch breaks, you know, yes, because they have a job and they have to, you know, continue to work, and they really can't take a half a day off. I've done it in cars. Occasionally somebody was driving and we had to stop that video visit abruptly. I've done it at, oh, this is my friend's house, I'm just here right now, but I remember I had a video visit with you, so we're going to go ahead and, you know, I still could do it because I had my phone here. So, you know, it is just such a positive response from the community. And, you know, yes, of course, there's always some tech kind of, you know, struggles. Sometimes, you know, if you can't get their video isn't, you know, coming up, or, you know, the audio isn't great. Yeah, we always end up reverting, you know, to a telephone appointment. But it's the effort that they're making. And if you are able to connect, that just like face to face that you're almost feeling is so much more than just having a conversation over the phone. You see the patient's eyes light up and just like so happy to see you, and, you know, show you around their home, you know, their dog. I just have a young girl that, you know, lives in a home with some other people, and they all got a dog. And so that was the first thing she wanted to show me. I had an 89-year-old I was able to do the video chat with. Her son managed to set it all up, and she was just like in awe, waving at the camera at me and such. So it's been such a rewarding experience as a provider. You know, given that we're in such kind of, you know, a difficult time right now, you know, you talk to these patients and the things they've gone through right now, you know, job loss, you know, family members in the hospital, you know, just being able to have that, you know, social interaction and, you know, a face-to-face, and in the comfort of like knowing that, you know, my provider's still there for me, still able to, you know, prescribe me my medications, you know, check in on my vitals, you know, make sure that my conditions, you know, aren't worsening during this time, keep me out of the hospital. The response has been just wonderful. And as a provider, it just makes our job that much more satisfying.
That's wonderful.
That is amazing. So, Dr. Dunnigan, I've got my new little Garmin watch here, and I've been geeking out on tracking my sleep and heart rate variability, you know, some of these things. And what do you see coming down the pipeline? Like, what are some things that, well, and maybe what if you could just dream, how might we progress health with some of this technology and connecting laymen like me to folks like you with some of that information?
Yeah, it's so exciting. We've been waiting for something like this to really kick off home monitoring, home devices. Part of that's the technology. We've had the technology for a little while. What we've probably been missing is the people and the business aspect of that. So suddenly now, with almost half of our business being virtual, having those devices in the home it's not just a nice to have, it's a need to have. So whether it's a blood pressure monitor, a scale, a glucometer for checking home blood sugar, to be able to link those via things like Bluetooth and feed them into our records so that on our end we can see that real time, those are going to be essential. Other things, I think of things that I wear them too. There's like digital coaching involved, and they can be almost little digital members of our care team. Yeah. So that suddenly this is all now in play, and it's really going to be a crucial part of this.
And what can you see as far as how will the actual structures change of, say, like your clinics or waiting rooms, the hospital? What might we see with that?
That's a very important point, because especially right now as we're redesigning a healthcare system physically with new clinics and a new tower, we know that virtual care is going to be a part of that. So having areas that afford privacy, there's some very sophisticated things you can do with sound curtaining. So you can have people sitting somewhat close together, and with sound curtaining, we want to protect privacy and all that information that's being shared. We probably aren't going to see as many people physically coming to a clinic anymore. So that can afford some efficiency with the business that is on site. I think when people come, it'll be more comprehensive. They'll come for their annual wellness visits. They'll come for more detailed exams. They'll come to get other tests done the same day. And we can do some things from an efficiency point of view to make that very value added for everybody.
Could you see this also as a way that you're sending more kind of like health tips and that kind of thing? I know health literacy in our family learning centers has been such a special part of why many of our donors have invested in our foundation. I'm imagining that that's another access point that you'd have for teaching more, but just to the patient instead of our future docs.
Yeah, that's a very important point. One of my other passion projects for years has been our personal health record called MyChart. So as you come and get care in our system, you've got a version of that at home that's readily available from the web. And suddenly now, that's a crucial piece linking patients in our system together when we're providing care virtually. So there's a wealth of information we can deliver through that application. There's a very nice smartphone version of it as well. And as patients come in, we work with them to make sure they've got the app. They're able to look at things. It's bilingual, not just Spanish, but there's other languages available for all that education. So again, I almost think of it like another little part of the care team, all this technology and information that we can more readily share with patients.
It's amazing. So for both of you, I think we'd all love to hear, if we could write you the biggest check, what are some of the things that you would dream of that we could make an impact on the health of the Valley?
So I think starting with the remote monitoring systems, and I can speak to this as a provider, when you get on a telehealth visit, whether it's telephone or video, sometimes the medical assistants involved, maybe they've called ahead and just kind of checked in to see if they can obtain any vitals, verify information, those kinds of things. But I want to know, like, hey, what's your current weight? What's your blood pressure today? What's your blood sugar today? What's your oxygen level? And especially in this current pandemic, I need to know these patients' oxygen levels, especially if, they're having symptoms that I'm, suspicious might be, COVID-19 or, them going into respiratory failure. So that has been a big obstacle, because a very small minority, of patients actually have these items at home. They're not necessarily affordable, especially for the population that I work for. A blood pressure monitor can put you off of probably like anywhere from $30 to $60. And, you know, if you're going to choose between that and putting food on the table, obviously, you know, the choice is obvious. So, you know, these kind of devices are game changers, you know, and like Dr. Dunnigan said, they are remote monitoring devices, meaning that patient doesn't have to necessarily verbally tell me their results. Some of these devices actually can send electronically, automatically into, you know, our electronic medical record system and update their vitals, their recent weights, you know, their oxygen levels, their sugar levels. The technology exists. It's just a matter of being able to provide this for the patients, you know, whether it's a package that they get in the mail if they, you know, qualify because they are a patient who has diabetes and they need a remote blood sugar monitor, or where they have blood pressure issues and they need a remote blood pressure device. I know it works because my father, he does use a remote blood pressure monitor, and he was just so enthralled with the tech when he got it, how it synced to the little separate, you know, monitor they gave him, and he didn't have to do anything. It just virtually sent to his nurse. So patients appreciate this tech, and really they are fairly simple, you know, machines to use. They work like any other regular blood pressure monitor or blood sugar monitor. So this would be probably a big first step in kind of helping push forward our telehealth abilities.
That's absolutely incredible. It made me think too that the gentleman that works on our landscaping here, probably about a month ago, he came and knocked on the door and actually told me that he had a heart attack, and Valleywise is who treated him. And I saw him this morning actually, and he just came, and I went out and I made sure that he had like a big cup of water and that kind of thing. And I can tell he's different. And I can tell that he's a little nervous now. And I could imagine it'd be so nice as this expands for him to have a little bit more access to someone like one of the two of you, where he can check in. And then even if, you know, there were monitors that he could be using, I mean, it would just be amazing. Dr. Dunnigan, anything on your radar as far as your wish list?
Yeah, I think Cassandra nailed it with the home piece. There'll be a set of tools in the patient's homes that'll just become the new normal as far as their ability to send us data. Similarly, on the provider side, you know, we've been going so hard, so fast, so quickly. We've tried to get providers where we can off their own devices and onto something, whether it's an iPad or, you know, anything with a camera or a webcam. So I think there's opportunities. We continue to spread this out to make sure we're equipping our providers with the right gear. All this runs on software. We talked about all the learners coming into our system, so that's licenses. So there's some cost to that. And then people. So, you know, we've got all these new roles. We've got tele coordinators and tele-facilitators. So we look for opportunities to fund some of those new roles as well. So, hardware, software, people, services. We've only just begun. We're starting to dream of where we'll be in a year or two. It's crazy. It's only been 3 months. It feels like longer, but you know, all that will require robust support, which we very much appreciate.
I know the last 3 months has felt long for me. I can't imagine what it's felt like for you guys. And it's an honor to do our best to serve you. I do want to mention, we had a donor end of March, beginning of April, wrote a pretty big check, little over $40,000 when he heard that you guys needed some cameras and some equipment to help connect some folks. And he had just had a personal experience with a friend that was in hospice, and he and this friend's family, they couldn't see him. And so he was really moved when he heard, you know, some of the things that we had going on. And I also just want to commend you and your team, because when he wrote that check, the time to get cameras and that kind of stuff was forever. Like everyone was ordering them so that they could work from home and that kind of thing. And your team, I don't know who you have as an insider, but we had equipment ordered and being delivered, I think, within a week. So it was just incredible. So really appreciate you helping us steward that donor's gift and getting it, on the front line right away. It's really incredible. So I have just kind of a couple playful questions, help all of us get to know you guys a little bit more. And, certainly being the Valley's only public teaching hospital and healthcare system, and maybe I'm a little biased because I'm a native, but I wanted to hear, like, kind of in light of community, I wanted to hear about your favorite restaurant in town.
Oh, great question. Wow. I haven't been to a restaurant in a while. I'll probably, there's an amazing Italian restaurant on Camelback called The Parlor. It's an old beauty parlor. So that's a favorite with my two teenagers and I.
Their food's amazing. I love their cauliflower appetizer. And
Yes.
Yeah, that's a great local spot. Cassandra?
I'm a lover of Mexican food. So there is a little mom and pop place that near where I used to live in Chandler when I lived there, called Julia's Mesquite Grill. And when everything closed down, like, the first thing my husband and I thought of was, please, oh my gosh, please make it through, because it's our favorite spot. Yeah. So we went straight there. They have a drive-through, luckily, and we were able to, go support them. So yeah, just a lover of all things Mexican food. Definitely, a bean burrito for me will always satisfy me any day. So
that's awesome. One last one here, in spirit of health and this great city and state that we have with so many great places to get outdoors. Is there a spot or an activity that you love, to take care of yourself, or just to adventure with family or anything like that?
I've been spending quite a bit of time doing some hiking, mostly here in town. I just recently moved close to Piestewa Peak, so it's just nice getting up there and seeing that still valley below you. It provides some much needed peace at times.
You should see the size of my ankle from a little crash on, it was actually on the trail that goes around Piestewa Peak this morning.
No.
Cassandra, how about you?
So I'm very fortunate to live right up against South Mountain here, and it's in the community I serve, as Lisa had said. And so, I love to run. So it's really nice to be able to get out in the mornings or the late evenings when it's cooler and just take kind of nice run just right up against the mountain there. So yeah, that's my little escape.
That's amazing. Well, do you guys have anything else for us? Again, thank you so much for your time today, especially with how much you have going on and all that you're doing for the Valley. It's every single person I talk to, anyone that knows what I do and who I'm connected to, I can't tell you enough how much every one of them has commended all of you for your heroic efforts.
Yeah, Nate, I just wanted to say thanks to you and Lisa for letting us share our story. It's pretty amazing. It flabbergasts me. So appreciative of the support of the foundation. We've really only just begun. We're going to be able to see this transformation play out this year. I mean, typically these things sometimes take a career, and to see this evolve so rapidly within months. So you can literally see where that support's going. So I just thank you guys and the foundation for all you've done.
Yeah, I echo that, to the donor who provided, the tech for us. Dr. Dunnigan knows very well, the minute I got that in my office, he got a message of me just like elated, amazing webcam, great headsets. And, it just makes so much of a difference, when you can have that, ability to have, quality tech so that, that's not going to be an issue in your visit, So yes, thank you so much to the foundation for what you've done for, our patients and also the providers. So.
You bet. We just want to keep doing more. I think everyone hopefully knows that.